very premature rush back to full normality. And I think we're going to pay a price for that because we're not there at vaccination. The variants are really there, and we haven't protected enough people. And I honestly think that we need to think our way through this, that we're opening up way too quickly for the epidemiologic situation and the risks associated with that.
All right, let's get some analysis on this by speaking to our health correspondent, Nicola Hill, who's joining us from London. Nicola, it's always good to have you with us. Thank you. It's always nice to hear from Dr. Ryan there, but I do wonder, is he being overly cautious? We've had 16 months of this pandemic. Don't we need to learn to live with this disease?
Well, that's certainly something that governments are saying, because a lot of people have said, hang on a second, we've got the vaccines. If the whole purpose of protecting us from getting COVID-19 is a vaccination, we've got them. Why are we having to live under these restrictions? Impacting on the economy. A lot of people have had enough. We've seen the pictures of people at the Euros basically abandoning a lot of social distancing, not wearing the mask, whatever. It's as though many of the public have said we've had enough now, so maybe governments have realised that and knowing they're having to ease restrictions. And of course there has been a real change in the figures. So in January this year here in the UK, COVID-19 was the leading cause of death. In May it was 26th on the list. And similarly, if you got COVID-19 in January, you had a 1 in 10 chance of being hospitalised. Now it's a 1 in 40 or 50. So that's why many governments are saying that we have to live with COVID-19. It's endemic. We've heard from all the scientists we're not going to get rid of it. And in a way, we have to live with it like we're going to live with flu, although they are two very different diseases. And COVID-19 certainly was a lot more fatal than flu. But similarly, as the WHO and many scientists are saying, this complete easing of restrictions, when you have so many parts of the world unvaccinated, is foolhardy. And there's quotes from a whole variety of experts, including Professor Peter Openshaw from the Imperial College here in London, saying it could lead to a breeding ground for variants if we have too many people who are unvaccinated and we are lifting these restrictions. So they're warning that although governments, certainly here in the UK, they're saying we have to take on personal responsibility to decide what we want to do in future, what the scientists are saying is no, that's not the case. Certain restrictions should be kept in place until we have much more of the world vaccinated and we know many more people are protected, and we're not going to have this breeding ground for variants as has been warned about.
Yeah, absolutely. We are in the next phase of this pandemic, aren't we, Nicola? And on that idea of personal responsibility, it does seem as if some governments are now allowing citizens to make those decisions. And it's a kind of a bit of a philosophical question, isn't it, really? Should we trust people to make those decisions? And can that be a way of suppressing this thing if people decide, if they're on a busy train or in a busy environment, to wear a mask, for instance?
This is the fear, isn't it? A lot of people, you know, I'm sure you've chatted to colleagues and friends, I certainly have here in the UK, and most of us are saying if we're in a crowded environment, if we're in a poorly ventilated environment, we want to carry on wearing a mask. And what you have to remember, of course, is that for the most part, wearing that mask is to prevent other people from getting ill. That's why we were all encouraged to wear it. I protect you, Kamali, you protect me if we were both wearing masks. So there is this concern. Will you have people who perhaps are more likely to disregard social distancing, more likely to perhaps not abide by hand hygiene, more likely to be a bit more dismissive, to perhaps not be vaccinated? Are they likely to not wear masks? Therefore, if they are infected, if they're asymptomatic, particularly if they're younger, they could still be increasing infections. And we do have to remember, although the vaccines are fantastic, they're not 100% effective. At least 10% of people who are double jabbed are still likely to get COVID-19. And of course, the other thing is long COVID. I mean, the figures of long COVID are rising. It's a major problem. It's going to cause a major issue, not just personally, but for healthcare systems around the world. So is that another reason why, if we're in certain situations, we should stick to wearing masks and social distancing. And that's what every single leading scientist that I've been listening to over the past few days say that's what they intend to do. And even the new health secretary here in the UK this morning, he said that if he's on a crowded tube, he will still wear a mask. So that's why certain people are saying, well, why don't you actually keep that as a rule, as a recommendation, and say if you're in a crowded environment, if you're in a poorly ventilated environment, if you're in a shop, wear that mask, protect those bus drivers, those shop workers who are likely to be inundated with virus if people are not wearing masks.
Absolutely. I think those crowded environments will see mask wearing going on for a little while longer. Nicola, thank you for that reporting.